Thank you very much, Dr. McCarthy. You have kicked off this discussion event so perfectly, because what we want to do is to move the discussion about COVID forward and stop blame apportioning and actually look towards what we have learned and what's positive that we can build on. And indeed, there is lots that is positive. So I'm very pleased to hear that. Just what a tragedy that we needed the Life Esidimeni tragedy in order to start getting systems in place. But at least there was something positive, and at least we go forward with optimism. We can have a question or two. Debbie, can you tell us what is in the Q&A?
Sure. Can you hear me?
Yes.
Wonderful. Well, there was, just in general, there was one question from the crowd, and I also have a question here. The question was from Evarista Umbatumbu about, I think it was covered in the presentation, but Dr. Kerrigan, if you can tell me if maybe you can put this in a nutshell. What Everest asked is, Dr. Kerrigan, is it possible for Listeria to return again in South Africa? If yes, what are the preventative measures taken to prevent such an outbreak? I think that it covered that, but if you put it into a nutshell, what would you say?
Yeah, certainly, thanks. So listeriosis is an organism, or Listeria monocytogenes is an organism that is found ubiquitously in the soil, and all fresh produce that comes from the ground or has contact with the ground is contaminated by Listeria monocytogenes. So really, principles of food safety apply in preventing cases. So there is a background threshold of listeriosis cases that are unavoidable and that will happen in every country in the world. The key thing is to ensure that food quality is of such a standard that the end product following food processing is free of Listeria, and there are very good and solid principles for this. The structures in place to ensure that we don't have a massive outbreak like this before are that Listeria has become a notifiable medical condition. All isolates of listeriosis or of Listeria monocytogenes that are isolated from patients are sent to the NICD and undergo whole genome sequencing. If sequences match, then we go back to a food history interview, which is conducted as a matter of routine on every patient who develops listeriosis, and we look and see if there are common foodstuffs. And essentially, this will flag a point source outbreak, such as we've seen before, much earlier. So globally, it was a bit of a shame that we, in fact, not a bit, it was immensely embarrassing. And never mind the loss of human life, that the Listeria outbreak in South Africa reached the magnitude that it did. It spoke to the fact that we had a very poor food quality and legislative environment, and that our surveillance systems were inadequate. But I'm absolutely confident that this will not happen again. At least that there will not be an outbreak of this magnitude again. Over.
Wonderful, thank you very much. And then one last question is, you know, when you spoke around communications and how essential that is for any type of outbreak and emergency response, you spoke about engagement with the community, but didn't really go into that as much. What do you mean by that?
So thank you. I'm not a communication specialist, but there are a number of levels at which engagement with the community is important. The first is listening. So community members tell us the stories that they're hearing and the meanings that are ascribed to the health events that happen, and the actions that that are being bandied about in the community that people should respond to. So listening is important because it allows us to correct misinformation. Good examples are that the COVID vaccine is injected with a microchip, or it's going to change your DNA. And it is important in then filtering back the listening into the health communication messages that come. The second key involvement of community members is to promulgate the right messages. Now, this can be done in a number of ways. Obviously, there are a whole plethora of traditional media, social media, down to even the health promoter in the clinic who speaks to patients while patients wait. So this is really a specialist area of expertise. It's not mine. I've just learned a lot from participating and working alongside communications experts. Over.
Right.
Do we have time for one more? Are we
Yes.
good? Okay, then I'm going to actually, from the chat, from Aziza Karwa, it said, what is now, Aziza, I'm not quite sure which virus you're speaking about. I presume the COVID-19. What is the incubation period of this virus? And when is a patient most infectious? That's Aziza Karwa asking.
So thank you for that question. That was one of the key uncertainties that was an unknown to us early on in the outbreak. And so it was very difficult to tell people how to look after themselves. So a good communications message should include the facts about the disease. It should state very clearly what is unknown, and then what authorities are doing to address the uncertainties, and then lastly, what the public can do to protect themselves. So because we didn't know who was infectious and how the disease was, went on the most at-risk periods, it was very difficult to advise people on how to prevent the disease. What we know now is that this virus is transmitted in greatest viral concentration within the first 5 to 7 days following infection, and even before a person develops symptoms. What we have also learned is that persons who are asymptomatic, and approximately 40 to 60% of people have COVID infection or SARS-CoV-2 infection and are asymptomatic, that asymptomatic people can equally spread the virus just as well as people who are symptomatic. And of course, this makes the need for the public health preventive measures that we are familiar with now to be very important. If you don't know that a given person is infectious, you need to assume that everyone is infectious. And this is why social distancing and universal mask wearing and hand sanitizing need to be part of our way of life going forward. Over.
Thank you very much, Dr. McCarthy. Thank you for your presentation.